Pam, as I said, she has been in this business for over 30 years. I know that's hard to believe because she only looks like she's about 32. So she started when she was in middle school or in elementary school. No, that's not really true. Pam actually has a degree in gerontology. She's a gerontologist and she is a serial learner. And so she most recently finished her licensed professional counseling degree and is now a psychotherapist as well as being a gerontologist. And she has her own company after I left her and she went on to do something else. She decided to start her own company. She started her own company. And so she's the president and founder of Atwood Dementia Group and is also a certified laughter therapist. So Pam has quite the breadth of experience in working in residential care. She has run her, she went through the construction process of a large assisted living facility. And so she has been actively involved on numbers of different letters. She is an amazing lecturer and trainer. It has lots of certifications in order to be able to do that work. Her bachelor's degree is from Clark University and her master's degree is from Southern New Hampshire University. And as I said, she's now a licensed practical counselor, which is why we don't get to have her more, but we're privileged to have Pam with us tonight. So thank you, Pam. And I will let you take it from here.
All right, Stephanie, thank you so much. It is truly my pleasure to be working with the wonderful professionals at CaringKind and to consider myself their colleague as well as fellow whisperers in the field here. So I appreciate everybody who's taken the time to join us this evening, and I hope that this will be information that is helpful and useful and easy to understand, although when we're talking about all of this stuff, it's always challenging because it's in the midst of chaos. You wouldn't be here watching this and participating in this program tonight if it wasn't something change or concern in your life that motivated you to be here and join us. So we're grateful that you took the time to do that. And hopefully we will be able to wrap in just about an hour. From now, we will definitely leave some time for question and answer. I do want to just kind of let you know a little bit about what I will cover. First of all, there's a lot of alphabet language in there in senior living and senior services. So I'm going to kind of tease that out for you. I know that historically we've made the presentation slides available after a presentation. If not, you can always just take a photograph of your screen and save that for future reference. But our professionals at our helpline, our CaringKind helpline professionals know all of this and can help you. So you are never going to be alone in this again. We've got you covered. We're going to talk a little bit about the options for the continuum of care. My dad always says you have to keep your options open, and I always say you got to know what your options are first, and we'll kind of lay those out for you. We're also going to talk about the cost of this because that's one of the hardest things that I think professionally my clients and the folks that I've worked with in my career really struggle with. The who pays, and I thought Medicare covered this, and I don't understand what do we do with the assets, and that's different than the legal and financial planning. Just because you need to be able to understand your apples and oranges in order to figure out, okay, what is reasonable, what are the goals, and what can we do to help a person achieve that goal within their cost constraints. We will also talk a little bit about the specific the general stages, but specifically what is needed at each stage for various needs, and where we tend to target as healthcare professionals and say, oh, you're at this stage, then you probably need X, Y, or Z. I do also have, and I forgot, Stephanie, to mention this to you, but I do also have a checklist that I've developed over the years for when is more help needed. So I will also share that and we can get that sent out to people who would like it as well. And of course, like I said, I will share that on the screen, maybe. Might be too cumbersome. I'll just email it to you. And we will, of course, do question and answers. Okay, so let's dive into the alphabet soup. RX, obviously, prescriptions. LTC, long-term care. This really can be a place or a type of care. A lot of times we talk about, oh, they're going into long-term care. Long-term care, when we're talking about it in that way, usually means assisted living or nursing home, skilled nursing facility. But long-term care can also be a type of support. Oh, she's getting long-term care services and supports. Or it can also be your insurance. Oh, they have long-term care insurance. So it's a little bit of a misnomer just to say long-term care is a facility, but we use them interchangeably. ADLs, I think many people have heard about that. A lot of us talk about ADLs a lot of the time. Activities of daily living. These are things like, how do you walk? How do you get dressed? How do you brush your teeth? How do you um, toileting, eating, all kinds of different activities. That's what is considered in the activities of daily living. And the instrumental or IADLs are the other kinds of activities, such as your bill paying, your shopping, preparing meals, cleaning, and laundry. Sorry if you can hear that. That's my dog barking. We're trying a new kind of cleaner here. Um, Apparently not working right now. The next one is an adult day center or ADC. And those are fewer and fewer in my area. I live in Connecticut, and in Connecticut, we have only a handful compared to, we used to have them in almost every community. But now we really have fewer adult day programs, just because they're not financially viable for many organizations. But ALF is not alien life form. Well, I mean, it is in other circles, but here we're talking about assisted living facilities. Sometimes you'll hear people call them communities or assisted living community. We also have memory care. That can be, usually it's referring to a specific unit within the assisted living, or sometimes a standalone memory care community. There are some companies that have standalone buildings, and there are some organizations that have a continuum of care, and a memory care building is specifically on their campus. HHA, home health aide, and that tends to be a medically supporting home health aide supervised by a nurse and with a specific care plan. Then we also have companions and homemakers. These tend to be, and I should have put PCA in here too. So there's some overlap. PCA is personal care attendant or personal care assistant. They are usually people who are certified home health aides, but are providing non-medical care, meaning that a nurse is not supervising their care. PCAs, companions, and homemakers all provide that non-medical care, usually in the home, but it can also be provided in an assisted living if someone needs more personalized one-on-one kind of support. Skilled nursing facility, SNF. Um, and a lot of times when I am working with families and they say, well, I don't understand. We call it a nursing home or a nursing facility. What is SNF? That is really kind of the Medicare and um, insurance-based kind of legalese skilled nursing facility. But typically we call them the nursing home. In the olden days, we used to also call it a convalescent home. CCRC is a continuous care retirement community, and these places usually require a big buy-in, but then you're covered for the majority of your care. Um, it depends on the annuity type that you buy. Sometimes you can put in more and they will provide more and more service if you need it. Or, for instance, my mother-in-law took a middle of the road one because she also had long-term care insurance. So she didn't need to buy in as much because whatever medical care she would need would also be covered by her long-term care insurance. So this is a graphic that I found. This was originally created by seniorliving.org, and it kind of gives you a smattering of all of these different places and different care options. This one, they have the level of care and supervision on one axis and the cost on the other. The CCRC, like I said, because it's a buy-in, and we're talking anywhere from $100,000 to $1 million, depending on the type of the community and where in the country they're located. So that is absolutely the most expensive, although you'll notice nursing home isn't far off from that. Nursing homes are, and we'll talk about cost in a minute, are also comparably priced. Most people end up utilizing Medicaid services or Title 19 in order to be able to pay for nursing homes. There are also retirement communities, 55 and older communities. There's congregate living. It says congregational here. We've always referred to it in my area as congregate living, which is where you'll have an apartment building where it's all 55 and older, or 65 and older, depending on the community. You can have senior apartments, adult day programs, independent living. You can do assisted living and personal care. There are a couple of typos on this, but I couldn't change it. So maybe someday Steph will remake this or a version of it or something better even. I don't know. Respite care is something that is a temporary short-term care option. In most communities, because they have to do a fair amount of background work to take care of someone efficiently. Most communities do a 30-day minimum for respite care. But you can get respite care anywhere. You can get respite by participating in an adult day program, or having home care coming into your house can also provide respite care. But respite tends to be a short-term temporary care arrangement. Um, and in this graphic, referring mostly to people living in a facility or community. Memory care, like I said, dementia or Alzheimer's care tends to be memory care. And I'm going to go through this a little bit more as I go. So don't, if you're just joining us or if you think I'm going, oh, too fast, we're going to break this down even further now. So what I like to do is I like to consider and define the housing versus the services. So here we have houses and apartments, and you can get services in all of these settings. Congregate living, sometimes those are HUD supported, federal government dollars supporting that congregate living. Senior or 55 and older, community housing, independent living, where someone is completely independent, assisted living, memory care assisted living, skilled nursing. You can also have a memory care unit in your skilled nursing facility, but there's really no differentiation as to the housing or also the level of service. Although many communities in nursing homes that provide memory care do require extra training, specific care planning, but there's no cost difference to have a loved one on a memory care skilled nursing unit. And then there's CCRC for housing. So the services that we use: outpatient care and support. So if you're independent, like my dad is very independent. He goes to his doctor, he goes to his physical therapist on an outpatient basis. My mom has also been very independent, and my mom and dad are both about 79 years old. They both are still full-time realtors, and my mom also owns a secretarial service at 79. Well, a couple of weeks ago, and I had seen this coming, like my birthday was the beginning of October, and I said, oh my goodness, this may be the last birthday with mom. She's really going downhill. Turns out she was having an exacerbation of her congestive heart failure. She spent almost a week in the hospital, 6 days, and is now home getting home care. So her visiting nurse is providing physical therapy and occupational therapy and nursing services, and she will get that on a short-term basis. And we'll talk about that a little bit more and how that's all covered by Medicare. So you can get your outpatient care and support until you need a short-term alternative. Um, we then also have programs and services at senior centers or other kinds of community programs like at CaringKind. You have adult day programs. Most of these work either half a day or a full day, and many people go maybe 2 or 3 times a week. But when we're talking about memory care support, my experience and most of my colleagues recommend you're going 3 to 5 days, because a person with a cognitive impairment, by the time they need adult day programs, they really need the structure. And that's what really helps them stay oriented to the rest of the things they need to do because they're not worrying about what else do I need to be doing and is anybody going to make dinner for me and where did I put my keys and did I wear these clothes already today or yesterday or etc. So, an adult day center really does provide almost like a prosthetic brain for some folks, where that structure helps them with a routine. We get up and we go to work in the morning, and I know when my alarm is, and I sometimes nowadays I kind of wake up a few minutes before my alarm. That's how structured I am. So, it really is important to consider that even though a person may have retired years ago, they may really benefit from the structure of an adult day program. Home delivered meals is another service that can be provided. I think that the Meals on Wheels of yesterday are really quite different. I was just picking up meals for my mom, and she has a renal diet and low sodium diet. And these meals were prepared and were amazingly delicious. I think that people in my parents' generation are like, no, I'm not doing that. That's disgusting. They all taste like metal. Well, they're not even delivered in metal anymore. So home delivered meals, I encourage people to keep an open mind about. Of course, you can also get the meal delivery services, which they just tend to be a little bit more expensive. Emergency response, like Lifeline and other kinds of programs, are available and highly recommended. I always say if you never use it, that's great. But if you need it and you don't have it, it could be very detrimental to your well being. We have companions and homemakers in the house that can come in. That's another service level. And like I said before, personal care assistance as well. Visiting nurse and hospice. And hospice is really a medical service, a medical benefit. Hospice provides a palliative approach with certain medical parameters, and we're looking more for comfort than cure. And it can be provided both in home or in a facility. All right, there we go. So, what does this cost? Generally, dementia is considered chronic disease, and therefore the dementia care is considered a chronic care need. So, therefore, by definition, dementia care is usually not covered by Medicare. There are some exceptions, and I'll go over those in a minute. Medicaid does cover some of these services, depending on the service in your state. Now, Medicaid is the health insurance for people with low income and assets. So you have to, um, Medicaid is a federal and state partnership program. So every state's guidelines are slightly different. But basically, when you are means tested, you will be determined to be eligible for Medicaid. There are several states now that have Medicaid waiver programs where they waive some of the community Medicaid guidelines to say, hey, this person's going to be in a nursing home if we don't start paying for some home care. So let's waive some of these rules and pay for those services in the community to divert them from having to go to a nursing home. In Massachusetts, for example, Medicaid will pay for assisted living if the community has that kind of a contract written. There's another big cost here that I didn't talk about on my slide. There are lots of services that are supported for veterans as well. So some of these services may be paid for by VA contract, again, depending on the service connection and on the organization's contract. All right, so let's talk about the services. US average is always a lot lower than most of us live in. So I'm in Connecticut, New York City. These are some of the highest costs in the country. Even Florida can be very expensive for some of these. Adult day centers on general $100 to $150 per day. So again, if you're only going 1 day a week or 3 days a week, it's going to be much less per month than 5 days a week. On average, much higher in New York City. Home aides on average $27 per hour versus 35. per hour. I've even had clients up here because we have such a crisis with staffing right now, where they're saying 35 to $40 an hour and a 5-hour minimum. Now, there are always exceptions to that, but it also depends on where you live. So if you're more inner city or more populated areas, like our West Hartford, Connecticut, you might be able to find an agency that does 1 hour minimum. Um, I just heard about one of those recently, actually, now that I'm thinking about that. So this home care, you think of a lot of times we say, oh, well, skilled nursing is so expensive. And it is. $9,000 to $20,000 a month for skilled nursing. It's exorbitantly expensive. But home care ain't cheap. And you still have to pay for your meals, your rent, your mortgage or your insurance or your taxes, your utilities, etc., your security. So home care is not always the least expensive option. Visiting nurses and hospice, these are covered by Medicare if it's a short-term service. For instance, like I said before, my mom's health issues right now are short term. If she had dementia and an exacerbation of her CHF, yes, her Medicare would cover her visiting nurse and her PT for this spell of illness. It doesn't cover all of her dementia care needs. It just covers the CHF exacerbation and the services related to that. Assisted living facilities, let me go back. Medicare, I think I have this in the next slide. Let me just check. Yes. Okay, I'll come back to that in a minute. Never mind. Assisted living, $5,000 a month US average. In New York City average, $6,000 to $10,000 a month. A memory care specific assisted living increases that cost. And like I said, skilled nursing facilities, it depends on which one you're at. And many people in skilled nursing do not have the private resources and therefore are applying for Medicaid to support that care. So when does Medicare pay? First of all, a patient must have a short-term, as I said, skilled need, something that a licensed professional must provide. For instance, a nurse, physical therapy, speech therapy. Now, occupational therapists can also be paid for, but they cannot be the only service or open a case. So, for instance, if my mom just needed some help with navigating the bathroom and all of that stuff, and OT was all she needed, Medicare would not pay for it. But she does also have the nursing need and the PT need. So it's paying for that. Once the case is open, OT can stand on its own for a short time after that. The client must be certified on a regular basis as still needing that skilled intervention. And the patient must be what is described as homebound, and or Medicare does pay for hospice. There are different levels of hospice. There's inpatient or routine hospice. Inpatient is pretty rare. A lot of times, patients in long-term care settings will have routine hospice, but inpatient level of hospice is really only for that terminal phase when they're actively dying. So how do we define homebound? And this is something I had to go through with mom and dad. A taxing effort, and they need help to leave the home due to their illness or injury, or if leaving their home is medically contraindicated. So they can have intermittent absences. They are still homebound, even if they go to church or synagogue every week, even if they go out for their medical appointments. And my mom had said to me, well, I have to go to my doctor. Why can't I just go to my physical therapy, out at the house? I said, think of how you called me today and said, wow, talk about taxing effort. This is taxing on dad. Yeah, it is. And that's exactly why you are considered homebound. Short, non-medical outings such as reunions, funerals, graduations, they're not going to let you go for a 2-week vacation. That's not homebound. Unless that's your secondary home and you will be able to get home if you're homebound there and you can get services at home at that second residence. outpatient services if you have to go out for treatments, dialysis, chemotherapy, or doctor's appointments. And this is relatively new in the Medicare scheme of life. Adult day program, if you have dementia, does not like, get rid of your homebound status. It does not eliminate homebound. So if you have cognitive impairments and participate in an adult day program, then you can still be determined to be homebound. I feel, Stephanie, like there must be a million questions, and it's so hard for me not to say, is everybody getting this? Because that's my go-to. I tend to talk quickly. I apologize. We're good? Okay, thank you. Okay, so let's talk about what is needed at the various stages. So, in the early stages of Alzheimer's and other kinds of cognitive disorders that create dementia, we have primary issues or loss of memory plus one other cognitive ability. At this stage, number one, we need a diagnosis. Several years back, they did a survey and found that 45% of people living with Alzheimer's were never told that they had a diagnosis. Now, I hope if that study was repeated today that that would have changed. And of course, it's hard to say. Maybe the person was told, but they didn't believe it, or they were in denial, or they didn't understand it, or they forgot the conversation. So it's hard to say, but we can all say that a significant number of people living with dementia maybe haven't pursued getting a full diagnostic workup. At this stage, we need to be looking at life planning. What are their long term goals? Do they want to go to assisted living? Do they want to stay home? Is that feasible? We really need to start having conversations with family and with the primary caregivers, family of choice. And I think that for a lot of people, they just say, oh, no, it's okay. I know I've got long term care insurance and I'm going to stay here. My husband just got back from California where his uncle passed away. He told the hospice agency he had no living relatives. He told his neighbors that he wanted to make it as difficult for his nephews as possible. Well, thanks, Uncle Mac. You did just that. Um, you know, he had plenty of money, but would not spend it. And we kept trying to say, okay, you can still go out to dinner with your aide if you pay for an aide. Instead of just sitting at the house saying, I'm miserable, no one can cook the way my favorite restaurant cooks, and yada, yada, yada. We can help support a person. Not everybody's open and willing to do that, but now in the early stages is when it's the time to have these conversations. At this stage, we rely on tools and tech, emergency response services, wanderer or safety, GPS, Life 360, those kinds of technology apps. All of those things help. Computerized medication dispensers, pre-packaging the medications from the pharmacy, those kinds of services and tools or resources in the community. This is the stage where we start using those. At this stage, counseling and coaching. A significant number of my clients in private practice are people living with the early stages of Alzheimer's and related to more dementias, but also coaching, talking with someone and saying, okay, this is what this is about, and here are the services, and here are the resources. I always tell my clients it's like window shopping. I'm going to show you all of these different windows. You get to tell me which outfit you like best. Legal, doing your advance directives, financial plannings, absolutely essential. You do not want, well, unless you're my uncle, our Uncle Mac. Uncle Mac did want, you don't want your estate held up in probate for years. Um, some people, I've always said nobody wants that. Obviously, I should never say never. At this stage, we also want meaningful engagement and cognitive stimulation. Simple things like learning about the mind diet, which is now proven even people with early stages of memory problems can delay the progression of their disease by following the mind diet, which is MIND. I don't remember what it stands for. It's something about neurodegenerative something, but it is basically the Mediterranean diet plus the DASH diet, which is the um, dietary for salt sensitivity. So those two combined, the original research on the mind diet showed that you really only had to follow it 80% of the time, which is fantastic because um, I think that many people think that at this stage of my life, it's too difficult to make big changes. And that's probably true. But these can be done with little changes over time and following it without an all or nothing attitude. In the middle stages, we take that last stage and add that they're going to start to need cues for meals, appointments, and observing for safety in their home or wherever that is, congregate housing, assisted living. Here's where we start to add companions and homemakers, especially for monitoring. And I always say I worry about five things when I'm talking about safety in the home: falls, fire, finances, med compliance, and wandering or getting lost. And at this stage, we're also talking about the IADLs. How are they getting their bills paid? Who's prepping the meals? A lot of my clients say, "Oh, well, I don't really cook anymore." Or they'll say, "I love cooking, but they haven't used their stove in a long time." How are we sure that they're getting nutritious meals? In the middle stage is when we start attending the adult day programs. Again, like I said before, more is better to provide that structure. They'll have visiting nurse for acute short-term health issues, home delivered meals, or the family or paid staff in the home will prepare at least one good meal a day. Really well balanced nutrition. Um, there is a certain amount of concern that we all have in dementia care about someone wasting away at the end of the disease. But at this stage, they start requiring fewer calories. Maybe they're less physically mobile, although that's not true for people in New York City. Um, they tend to be some of the most mobile clients I've ever seen. And it is important that we look at the caloric needs. More importantly, their hydration needs, because dehydration, urinary tract infections, all of those other kinds of challenges with medications and being dehydrated. These are significant. They create significant health concerns in the community. And again, we're looking at how do we keep them safe in the home of their choice. If they don't care about hydration, great. I hope they like nursing homes. Okay. Because, and I just had that conversation with mom 2 days ago. It's really simple. If you're going to follow your fluid recommendations, you're going to be able to meet your goal of staying home. Pre-poured or packaged meds, you can get them pre-poured on a card where they have little plastic containers built into the card with all of your pills. And maybe we have it depending on how many pills they have. They might just have one row for morning, evening, what have you, or they might have a separate card for each time of day. But those kinds of services are now available from online pharmacies as well as some of your local pharmacies. You can also get them in little pouches and they come in a roll. So you could just tear off that pouch and you've got Monday morning right there. You just tear it open, take your pills. So it doesn't even have to be in one of those pill boxes. I use a pill box myself. I pre-pour them every Sunday morning, and I don't know how people who just look at their bottles do it. I really don't, because I'm 56 and yeah, sure, I have my own memory challenges, but if I was living with cognitive impairment, I would be really concerned about me. You need at this stage really to have emergency backup plans, whether it's for foul weather or a caregiver who's sick. We really learned during the pandemic that isolation and loneliness is a killer. They say that people who are isolated and lonely, it has the equivalent of smoking 15 cigarettes a day. Takes 8 years off your life. So we want to make sure that people are getting socialization as well as the medical supervision and services. But in the case of an extreme weather situation, and we've seen so many of them recently in places where we never would have expected them, we all need to prepare those backup plans. Is there a frozen food? Is there canned food that doesn't require electricity to cook? Those kinds of things. Not forever, but just for a day or two. Many families now have in-home cameras. And, we used to call them nanny cams, but now we just call them ring cameras, right? Or whatever the brand names are. These have become invaluable for freeing up the caregiver from the constant worry. As a caregiver, you can be at work, you can be out with your daughter at her college event for Parents' Weekend, but your brain is still a caregiver somewhere else. So having that in-home camera really does provide some of that support for the caregiver to feel more comfortable. I know a lot of people say, there's no way I'm putting up cameras in my house. A client now in Connecticut whose son put up cameras and I'm doing therapy in her house with her, like psychotherapy. And I'm like, this is not okay. We need to turn this off. I'm not comfortable with your psychotherapy being done in front of a camera. And we don't know who's got access to it. So these are tough conversations and a lot of ethical issues, but have the conversation. I think it's valuable. And I'm a Libra, so I could go either way on that. Caregiver support, especially support groups, information and education for caregivers is vital. Otherwise, it's a fast track to burnout. And we have to adapt the meaningful engagement. So instead of maybe going to cognitive stimulation therapy, now we're going to the Connect to Culture programs at CaringKind or what have you, where it's adapted. It's still meaningful to them, but it's adapted for success, failure-free activities. That's really essential at this stage. Now, in the end stages, we're adding all of that other stuff that we talked about, and now total care or anticipating all of their needs, whether they're in a house or in a long-term care setting. This includes their personal care, oral health. I just had a class that I gave on Friday here in Connecticut, and a speech therapist attended, and she told us the most amazing thing. Swallowing problems swallowing water in and of itself does not cause aspiration pneumonia. What happens is when you aspirate water, normally it's absorbed, but because of poor oral health, the bacteria in our mouths is what's causing the pneumonia, the bacterial infection associated with aspiration pneumonia. My mind is blown. All of these years, it's because you swallowed wrong, it went down the wrong tube. And that's true to some extent, but water in and of itself will not cause aspiration pneumonia. The trick is, how well are we doing with oral health? In my experience, 30 plus years in senior living and senior care, we're doing a very poor job of oral health. Some of this is generational. I do believe that this will change. And maybe I'm just naive and Pollyanna, and I have a good friend who's a dental hygienist, but I do hope that that's generational. Personal care also needs to consider assistance with their meals, that they may need a therapeutic or textured diet, whether that's adding nectar thickening um, powders or what have you, thicket to their juices or their coffee, but also chopping the diet or a puree diet, depending on whatever a speech therapist determines. And they may lose the manual dexterity to handle the silverware. So you may need to do foods that are finger foods, or they may need assistance being fed. Close monitoring for fall risk, close monitoring of skin integrity. Pressure sores need to be avoided. They're very, very painful. And at this stage, it's not that they don't need any activities, they need sensory stimulation. Otherwise, they slip into sensory deprivation. Okay, so how do we navigate these waters? Like we said earlier, call our navigators at CaringKind. Speak with a specialist. You can also hire a coach or a care manager. A lot of families will hire a care manager who is then in charge of the hiring and firing and the adding to the care and the figuring out when more care is needed. And I probably should have put that in as a service. Um, I'll have to add that when we go back through the through the slides later because that is an important service for many, many families. Uh, some people refer to it as probably not the care managers, kind of a rent-a-daughter, because in so many cultures, the daughter or the daughter-in-law is the primary caregiver. A bit of a misnomer, but because there are certainly plenty of male caregivers, excellent male caregivers. Work within your family, divvying up tasks. In my family, Abby is the business person, Debbie's a nurse practitioner, and I'm me. Um, and I keep telling them, hey, unless someone turns up with a memory problem, I'm not needed. So you guys are on your own. I'm only kidding. I'm the one who's 4 minutes away from mom and dad. So I end up with a lot of it, but I have wonderful sisters and their spouses and my spouse who can assist with everything that's needed. Also navigate by talking with peers and support groups. Find out who are the agencies that they relied on, what service helped their parent the most or their spouse the most. Having no plan truly is a plan. It's a plan for chaos and stress. And I encourage all of you, and I know I'm kind of preaching to the choir here, if you're on this webinar, um, you're someone who's trying to put together a plan probably or affirm that your plan is a good one. Make sure you take the time to make a plan. We all dread that phone call that it's the coroner from Sacramento County, California, or um, you got to get over and get mom to the hospital because she's having chest pain and can't breathe. No one wants that plan. But if we don't plan for and have a go bag ready, or have, a home care agency that we already know, or have had, Sally Sue down the road, had them and loved them, we have to have some amount of plan. Like we said, here's the number 646-744-2900. You can also get to them by helpline online, helpline at caringkindnyc.org. Helpline at caringkindnyc.org. All right, I think that's it. Let's open it up to questions. You're muted, Steph.
Thank you so much, Pam. Very helpful. Just to remind you all, folks, that if you have a question, feel free to type that into the chat. If any of you would like to ask a question personally, you're welcome to do that as well. You can turn your video on and raise your hand, and we'll help you get unmuted to ask your questions. There was one question while you all are thinking about it or asking in other questions, just to clarify a little bit about the day program, the way a day program works, that is a paid. There was a question of, do you have to have an aide to go to the day program, or how does that work? And so just to reiterate the adult day, how that works, and who the fees for
Yep.
that.
That's a great question. So there are typically two models of adult day program. One is a social model, and the social model is really just a gathering place. A medical model has a nurse who can do monthly assessments, might be able to assist with medications during the day, can assist with toileting and showers, and supervise those nurse aides that might be on staff as well. So, two different models, both are fee for service. Many states that have those Medicaid waiver programs, like I said, will pay for adult day as part of the care plan if you qualify for the Medicaid waiver. But then also, do you need an aide? No. What they will do is they drive up to you. Now, they're not going to go into your apartment building and get you. You're probably going to have to go down and wait in the lobby. And you might have to have an aide get you ready for the adult day program, but then they usually provide transportation to and from. In Connecticut, that's a requirement for a certified or licensed adult day program. They also do provide meals during the day, activities, and can assist with communication if it's a medical model among the other medical providers. So I hope that answers that question. But
Yeah,
generally, if a person's pretty independent, they can get on the bus themselves and go. But you don't have to have an aide to go with them. Not unheard of, but it's not required.
Right. I think another option is that there are some programs that are more engagement programs. And actually at CaringKind, we have a number of social engagement programs that are not the same as an adult day program. And so for
Correct.
those types of social engagement programs, they would not necessarily, those might actually require somebody to attend with the person who has the diagnosis. And so that's something to clarify. Whether those are kind of a drop in or a drop off, that language is something that they're, you know, that's out there. Similar to like going to, you know, like
Going to a ball game.
right, exactly. Or, you know, a senior center, someone could go independently to, whereas, you know, something like Meet Me at MoMA may or may not be something that a person can go
Right.
to independently. And a lot of that, quite honestly, has to do with assistance in the bathroom. So
Right.
for example, at CaringKind, you know, when we have a social engagement program, we aren't a licensed, you know, daycare. And so we don't have the staff or the flexibility or availability to assist someone if they needed help in the bathroom. You know, we
But
couldn't actually do that because we aren't licensed to do that.
that said, you do offer free engagement programs during the day. Usually when we're talking about adult day programs, it's a set schedule. So from 8 to 4:30, for
Right.
example, or if you're going to do a half a day, 8 to noon. Um, I see that the person in the text who asked that question was looking for free ones. I don't know personally of any free because it does cost to do them, to run the programs, but I would say call the helpline and find out if they have any resources.
I mean, I'm sorry, I was the one who asked that question. There's
Okay.
senior daycare day programs.
Mhm.
They're all over the city in New York. So those are the ones that I am curious about, whether you need to have a caregiver with you to go into those facilities. I guess the thing to do is to call and find out.
Yes,
Correct.
exactly right.
Yeah, definitely. And like I said, it depends on whether it's a social engagement model or a medical model. Yes, they are becoming more scarce because if you're only charging 75 or $85 a day, I mean, my gosh, with the food costs now, let alone your overhead and your staff charges and your, you know, your bus gas and whatever, you know, it can be really challenging. So, it depends on the area. Like I said, there may be more in the city just because you have different transportation options and different settings that are available to
A
you.
lot of programs, I mean, it's a struggling business. Adult day
It is,
programs are a very struggling business, and a lot of them with, you know, really struggled during COVID.
for sure.
Yeah. Any other questions for Pam? I think I fixed it now. If anybody has a question, you can raise your hand. You can turn on your video. Right, Annette, it looks like maybe, do you have a question, Annette? You're gonna unmute yourself there. You're still, there you go.
You mentioned the social engagement program. So they have any in Brooklyn?
There are a number of engagement programs, and we actually have a list. Our helpline has a list, and so what I would suggest in that is if you can give our helpline a call, we can send you the list. Or I don't know, Rochelle, whether you've got quick access to that. I know we're having some technical difficulty to drop things in, whether there's a list that you can actually just put a link on the chat. But in that's the best way to do it is if you put your email address in the chat, then Rochelle's one of our navigators who is on the helpline. And so actually you could call and set an appointment to have a conversation with Rochelle. Okay, perfect. Thanks, Rochelle. She just put the link in the chat there for you all.
Oh, okay. Because the thing I'm concerned about is she used to go to adult daycare center, right? And a couple of them, as you said, they closed down. And she ended up going to another one. But during the COVID, you know, no more daycare. So now she has no interest in going back to that one. And she had a little experience there as well. So she doesn't really want to go back. So I tried to get her in other ones, but since you mentioned the social engagement one, I figured it would be a little bit more interesting. Right.
Yes.
So, okay.
Yes.
So I'll try that one, see.
Yeah.
Right, so there's so there's kind of social engagement activities, and actually this goes to, I think, your question in the chat. And then there are social model day programs, and then there are medical model day programs. And that's kind of how the progression works. And so if somebody's in the early stages, doing social engagement types of activities are probably the best, fit for where they are in their abilities and their interests. The social model adult day program, and Pam, I realize I'm stealing a little bit of your thunder here, but we've both been in this business, and so the social model adult day program is still a day program where you pay the rate. They're going in a supervised setting. The difference is that they don't have the medical team. It's a different type of license and what they can actually offer in the day program. So they can't do medication management in a social adult day program, whereas in a medical model day program, the nurse could come and administer medications, for example.
Now I get it.
Okay. Mm-hmm.
I see one of the questions in the chat is about early versus middle stage, and there is no real clear delineation. That is absolutely true. These stages that I've shared are very, very general. In my experience, someone's appropriate for an adult day, when someone is appropriate, totally depends on the individual. I'm pretty sure my mom would go to an adult day program now if she didn't have to, bill her invoices and pay her staff. But that's just the kind of person she is. She's very social and she loves to be entertained. Um, I have a client right now in the city who I coach, and she has no insight into the issues with her cognitive status and has absolutely no desire to have an age. She would never go to an adult day program. She does go to the programs at CaringKind because that's a nice place to visit. So sometimes we have to be flexible in what we can put together for a menu of service for them, or kind of like a diet of services for them, so that they can be comfortable in their own skin and with the sense of their future. I have a lot of clients who say, "Oh, I'm not that far along yet. Oh, if I ever get like that, just oof." There are some people who are really struggling with their own changes and what they view as losses. And they are losses. I mean, memory loss is a loss, but and cognitive changes are a loss. I'm not minimizing that or saying that it's not. But some people, probably by personality type, are much more easygoing about it than others. It totally depends on the individual. It also depends on the center and what they have going. If they're the kind of center who's always going out and doing different activities, that's going to meet one person's need. But if another person has a lot of physical impairments and they don't feel good a lot, then being that physically active and going out 3 times a week is, you know, doing different outings may be too much for them. So it really has to be person centered, and decision making has to be done with the person in mind.
Thanks, Pam. I'm going to just show you all for a minute here. Rochelle actually put this link in the chat. And so this is available on our CaringKind website. This is kind of a resource finder. And so you can see on here, resource listings are available here. And one of these is for adult day programs. So if you just click on this, you'll actually see here is in kind of a comprehensive listing of all of the different daycare programs, according to the areas that they serve. And then here's their website. And so you can definitely review those on your own time. I was thinking, Pam, that probably another thing for us to do would be to add into the slides maybe some of the additional resources that people can access. For example, for nursing homes,
Yep,
Medicare,
nursing home compare.
right? Medicare, do you want to talk about what that
Yeah.
service is?
Should I do it with or without my personal bias?
Just this.
So there is a resource available to people called nursinghomecompare.gov. And I believe that they also now have other services available on linked sites. So here's where the Center for Medicare and Medicaid Services at www.nursinghomecompare.gov will let you select various nursing homes in your area and help you compare them by looking at their star rating, by looking at the size of the facility and their resources and their recent citations, etc. My bias is that there's good and bad in every single facility. And I have seen 5-star facilities that I wouldn't put my dog at. And I have seen 2-star facilities that I absolutely love and think they're doing a great job. So you really have to, it's like looking at a college campus. You have to go and get a feel for the place. And I think that that's really important. Um, Whether you're paying privately for a nursing home or for Medicaid, facilities. Both of those are covered on that site. So Medicare.gov and nursinghomecompare.gov are the places to look for those resources.
And there was a question on that will
Mhm.
list both Medicaid and Medicare providers. And so there was a
Yes.
question about that. It does show who takes Medicaid for
Yep.
those nursing homes. I think there are a couple of other resources I think of. So Leading Age is the National Association for the not-for-profit residential service providers. You can go to the Leading Age site. And then is it CALA? Who's the
Well, the Assisted Living
Assisted
Association,
assisted living?
and there is also a National Healthcare Facilities, which is the for-profit nursing home providers.
So I think we can add that resource
Yep.
list into the slides so you all have access to those links. I see, is it Kathy?
A raised hand.
I see a raised hand.
Kate, yeah.
That's
Thank
Kathy.
you.
Thank you. Mhm.
So I'm new to CaringKind. I just learned
Welcome.
about the about you. My mother had a stroke in May, and she's now living with us. She's been here a month, and I'm trying to get the lay of the land in elder
Yep.
care in New York, and it seems like it's really difficult. I talk to social workers, I talk to people, and they're like, oh, you should look into this, oh, you should look into that. But I like to talk to somebody who can give me an understanding of the structure of how things are set up. Where do you suggest I do that? I mean, is CaringKind the kind of program that will give me that? Or who do I talk to? Because I really like to understand it before I grasp here and there for the various programs that she could be eligible for.
Yep. I think you started with a great first effort just by participating in the webinar tonight. Definitely call the helpline. That's exactly what they do. And their coaches, so if they determine that you would actually benefit from coaching, you can meet with a virtual coach, to help guide you through that whole process. And all of that's at no charge through CaringKind. So I do think that they can help you with some more specifics. So, we may be talking about an adult day program, but that may not be what mom needs, depending on how long ago her stroke was. She may actually benefit from visiting nurse, PT, OT, speech therapy. It really depends on that personal situation. And that's what the helpline is for, is to answer those personal questions.
And I would say there are probably at least 2 of the webinars that I mentioned that are upcoming. So the understanding the legal, financial, and the Medicaid, actually 3 of those will talk a little bit about like if now that she's disabled, what does that actually look like? And then Adina Siegel is going to be doing a talk on benefits entitlements and how do you access them and that's kind of an introductory talk to what is the lay of the land. And so that would also be a good starting place for you. But we're making that information available. You know, you can get that one-on-one in a conversation with one of the navigators, and you can also tune into those. The accessing benefits is a new talk. And part of the reason why we split this off is because there's so much information and it can be overwhelming. And so we're trying to do these webinars kind of, a little bit more intentionally around, okay, here's this topic. We'll give you a little bit deeper dive. This topic, it's a little deeper dive, understanding that may mean that there's 5 education topics, but we're trying to give you due diligence to understand what the different services are, how do you navigate them, how do they hang together. And so welcome, and we're glad that you're here and that you came tonight, and we'll certainly want to be there with you as you're going through this.
Thank you so much. I really appreciate it.
Sure.
And thanks for caring for your mom. She must have raised you right.
Mhm.
We have 2 other questions that came in through the chat. Number 1, are there social activities that take place after hours? We were getting so good at that before the pandemic, and we switched a lot to virtual. So, I would say in my experience, Steph, maybe I'm wrong in the New York City area. I don't know, or Rochelle, maybe you can share. I don't know a whole lot of places that are doing after hours or after business or weekend or night hours. At one point at Hebrew Senior Care, we were actually applying for a grant to do a night day center program,
Yeah,
which
if it
would
was,
be a different name, I suppose.
Pam, you're correct. I think before the pandemic, there was really kind of an emerging field of kind of alternate support solutions
Yep.
kind of across hours and weekends, and that
And
seems
across the globe. I
right,
mean,
right.
not just in our area.
Yeah, I think especially for people who need more advanced support, I think there are some engagement opportunities on the weekends. Evenings are challenging and typically not something I think that's on offer, because individuals who are living with dementia by 4 o'clock in the afternoon. I mean, we've even found in programming kind of between 10 and about 3 is the limit, because it's just too. By after 3, people are just too,
They're exhausted.
they're exhausted.
And we start to see the sundowning symptoms.
That it's just the brain has been working too hard. And so engaging at that point is very challenging in a way. And the need for supportive options, kind of more adult day type of support, is actually needed at that point, because people are tired and it's challenging. And if you're a family member who has divided responsibilities, that can be a very difficult hour. But I'm not sure. I think that if those programs exist, they're few and far between.
Yeah. Thank you, Steph. The other question that came in was, it seems that you have a different continuum of care if you have no money. And would there be a different slide set if I was to tease those out? Yes and no. If you have a lot of money or absolutely no money, you're totally fine, because the Medicaid waiver programs do exist to pay for the adult day programs, the homemaker, the visiting nurse, the companion services, the emergency response system, even counseling. So those kinds of services and supports are available to people with limited means when they go through that asset test. And are determined to be eligible for the Medicaid waiver programs. The rest of us in the middle kind of get the short end of the stick here. I do think that's another generational thing. And I'm going to tell you that because my parents do not have amassed wealth to afford long-term assisted living. A year or 2, sure. But long-term, no. And so what's happening now, and I did see this a little bit with the assisted living that I worked in, we had people who came into assisted living, husband and wife, because the spouse had dementia. And now, several years later, we find that the wife is out of money and is now looking for, subsidized housing because she's used all of her money to pay for the assisted living. And she's still healthy and well for now.
It's really an area of advocacy that's needed, because the long-term residential solutions for people who are living with dementia are really inadequate. They're because we really need an assisted living level of care for people who are dementia, and for Medicaid to pay for that. And that
And we used to.
only exists in very few places.
We
Yeah.
used to have it. It was originally called the rest home level of care.
Mm.
And that was an intermediate care facility. So it used to be, when I started my career, we used to have SNF and ICF. SNF was skilled, ICF was a more intermediate care facility in the same facility, but different level of care. Then we got rid of ICF and said, okay, it's all SNF,
Mhm.
all SNF. And that's when assisted living came in as a private pay option.
Yeah, no, it's a long-term residential solutions are challenged, and the need is growing. And so there's definitely something that we're advocating for. And thankfully the need is known amongst kind of particularly leading ages working to solve this, but unfortunately it's not happening at the pace that we need it to happen.
Yeah.
But there are, as Pam said, there are solutions. I think the way I would respond to that is if you have money, or if you have when you look at the assisted living options, Pam gave you kind of the average ranges. You could pay $50,000 a month for certain assisted livings, in the city. Those exist as well. And so we aren't showing you those slides, if your resources are significant, then there are different options available, but there are private pay out-of-pocket options.
Someone had also asked, I know we've got to go for time. Someone else had asked, there's some flexibility in where they should live, should they move out of upstate New York, etc. I would say if you're considering moving to a different area, like I've got one client who's visiting her kids in St. Louis this week, and they're thinking about moving down there. We really, quite frankly, my recommendation would be to call the area agencies on aging in whatever area you're looking at moving to. They're the ones who can tell you what is covered in what areas, and whether or not services and supports are available in a specific community. And so the area agencies on aging are your best source for that.
It's what's available and the different regulations really vary significantly from state to state. My mother's in Florida, and she lives in what's deemed independent living there, and if that was here, it would be licensed as assisted living. And so it really and navigating that from state to state is different. But I will tell you that it's significantly cheaper. The level of service that she's getting, the quality of service that she's getting is definitely significantly cheaper where she is than what she would be able to afford here. So there is that variation, and that's again also why we're trying to provide some education around this. I think Pam mentioned that you have a checklist. I think
Yes.
kind of the next level of what we want to be able to do with you all is what are the right questions for you to ask. And so we can work on getting those resources available for you as well. Yeah. But I am conscious of the time, and I want to say thank you, Pam, for your generosity and sharing your time with us today and your experience. And we hope that this will be helpful.